All right, I think we'll go ahead and get started. Did everyone sign in already? Did everyone get a? Do you want to see what we wrote? I got that from your LinkedIn.
No, I know.
I guess I'll stand over here. All right. Good morning, everyone. It's Friday. Woo! Hey, can you sign in, please? Sign in. Sign in. So as you come in, sign in. Grab an index card and a Post-it note. Write your name on the index card, and then on the Post-it note, answer the question up here. What brought you here today, or what do you hope to learn today? I'm super excited, not only because it's Friday, oh, thank God, but not only do we have our other professor here today, Professor Mike Manalo-Pedro, who you've seen in some of the lecture videos so far, but I'm really excited to have Heidi Tuason here today. Sign in, please. Actually, let me just move this over here.
Yeah.
If you could write your name here and then answer the question on the screen right there. Should I introduce you or do you want to introduce it? And everyone should have their have one of the handouts. There's a long list of reminders at the bottom, which Professor Mike will go through at the end, but you don't have anything due this week, but you have several things coming up, which hopefully you read my email about how they all work together and build on each other. So without further ado, I'll go ahead and introduce Heidi. I guess I won't, I don't really like reading directly from these things, but I had the privilege to meet her 4 years ago. I was starting my MPH at UCLA, and she was starting her DRPH, which is kind of like a PhD for public health, but more practice and applied. And over the years, I've just really come to admire her for all the work that she does in the public health space, but more specifically around Filipino community issues, communities of color, mental health, ethnic studies, arts. Basically, she's like my goal. But as you can read from her bio here, I think, is it on here? Maybe not. But she went to UCSD for her undergrad, majored in bio and ethnic studies, I believe. And she actually went to school with Anna Kapinpin, our program coordinator's sister. Small world. And then she went to UC Berkeley for her master's in public health. She's worked in the Bay Area in community clinics and whatnot. She'll get into more depth about all of these things. She spent some time in the Philippines, and now she's a fourth-year doctoral student. But fifth year doctoral student then. Sorry, this is trying to restart. So I'm really excited for what she has to talk to you all today, so I will get out of the way and let her start. Thank you.
Yay, welcome, Heidi. So if you haven't already, please, did everybody get an index card? So actually, for the first like 3.5 minutes, I'm gonna have you all stand up. So leave your card with your name. Have it facing me so I can read it. But with your the thing that you talked about on your Post-it note, stand up and find someone you don't know. So I want everyone to be standing in this like aisle. Not an ideal, like ideally my classroom would be in a circle and we could like see each other, but so we're all gonna stand in this area in the middle and find someone you don't know and talk about your Post-it note. And then after you do that, find someone else and meet them. So you have 2 minutes to do this. 3.5.
Yeah, it's kind of an awkward space.
No, but there's this nice space in the middle.
Yeah, that's what last time we did something where it was at you identify someone who has like a similar trait, like, oh, this is my first year on acting house appointment. You probably could have like moved the desks over. But
No, I tried that before. It's too hard.
Yeah, no.
Desks are too heavy.
Do you have any questions about assignments? I know. So remember, for this one, this is a grade. This one is the passion planner thing, but at year 1 and 3. So they were supposed to do it 3 months and lifetime.
I'm not gonna go see it.
So switch if you haven't already. Find someone else that you don't know.
Oh, I love that.
We could have used that yesterday.
Where'd you get that from?
My community members gave it to me when I left to go for my doctoral program.
Do you remember? Where?
They got it from Jefferson, somewhere in San Francisco. I think China. I actually don't know what these are called.
Just for they're Chinese?
The Filipino Mental Health Institute gave it to me. And I was only going to use it for the centering thing that I do at the end. But I forgot my phone. Usually I use my phone and put a 1-minute timer. And it goes,
oh, you can use this?
Oh yeah, you can use this.
Oh.
There's a timer.
That's okay. I'm just looking at this. All right.
So, yeah, this one is due. Whenever it's the grid, it's always. And then this is the one that.
Raise your hand if you met 2 people.
So I'm not focused mostly on this.
Yay. Okay, so if we could like stand in like a little bit of a circle so we can see each other. So what are some of the things that you heard or maybe that you talked about? It looks like it's about to dance.
I know.
Soul train. So what are some of the things that you heard that people want to learn? You could either talk about yours or
so my partner was telling me that she wants to learn more about like public health and mental health, and like she wants to learn there's like cross between the two.
Yes.
She's kind of like stuck between like which one she should do.
Personally for me, when I went to some of my people I met, was my best friend from back home is actually making in public health in Casa de Ley. So a lot of times we have conversations. What she's interested in research is that correlates to what I'm interested in research. So I feel like I'm really interested in this topic. And she's actually working with hazmat in LA. That's what it's called, hazmat. But yeah, so like I want to get to know more how maybe like my field, I'm interested in social work. Others could like relate to public health.
All right, so just in the interest of time, I'm gonna have maybe Erin, could you get collect them and put them somewhere? Maybe over there, up there. Thank you for participating. So hopefully you learned something about it.
If you didn't actually write on it yet, please write on it.
That's okay. It's just to break the ice. So thank you for doing the activity. Sometimes I like come up with these activities for my students, and it's like a total flop. Like it like totally doesn't work. And so, so thank you for humoring me with my weird activities.
And it also proved that you guys can talk. So.
And hopefully you met someone. I heard that this is kind of a hybrid class, so you don't get to see each other every week. And so hopefully you met someone else in the room. Maybe you had something in common, or maybe you learned something new about someone else. So another thing I just want to know. So I'm going to do these two. Is anyone Filipino? Anyone speak Tagalog? Sweet. Okay. So what is tumayo ka? Stand up. Okay. So I want to just kind of get a sense of the room. She told me a little bit about. Erin told me a little bit about who's in the room. But so tumayo ka, which is stand up if you're first year. Sweet.
Well, first year, like freshman or first year here at Cal State Fullerton?
Both. First year at Cal State Fullerton. Sweet. How about if you're graduating this year?
I want to like give a round of applause.
And what if you're in the middle? Like, you know, you're not a first year and you're not. Okay. Okay. So I understand. And then, let's see, majors. Tumayo ka. Stand up if you're like a science major. or science or health?
Health science?
Well, there's health science, and then so do you consider health science a science?
Yes,
Health science.
health
There's
science.
at least like a couple.
How about like humanities? Social
Humans.
science? Okay, just so I have a sense of the room. Okay, great. I said I'm gonna skip this other activity in the interest of time. So just the goals of this workshop. So some of it, I'm gonna switch between two PowerPoints because in the middle of the night I had like a enlightening thing and I thought about what Erin told me and I was like, okay, I want to do more of this. But I do need to do kind of an overview of like what basic info about public health. You'll get a little bit of a sneak peek of my experiences as a public health professional. I'll provide you with some resources to learn more. I have a little handout. And discuss a little bit of next steps to take. But I think Erin emphasized to me last night that just to share my journey and kind of where I came from. I was in your seats 10, 12 years ago, and I was telling my students yesterday, like, I had no idea what I wanted to do when I was in your age. Like, I would have never imagined that I would be where I am here when I was 20 or 21 or 22 or 19 or 23, 24. And just to emphasize that it's a journey. So then I'm going to switch video. You see my screen? And my video. Hopefully the sound works. We tested it before we got here. Oh, and this is not a video made by me. I will show some videos made by me, but this is not made by me. Not a condom yet. You got it. There we go. That's the next So it's by the American Public Health Association, not made by me, fortunately. So yeah, have any of you seen that at all? I know it's a lot of text for 10 a.m. in the morning, but it kind of gives an overview of kind of what are the different things in public health that you can cover. How do I get back to my screen? There we go. Ooh. Oh, I'm supposed to introduce myself. So I'll go more into my trajectory, but just to introduce myself, I'm the daughter of Filipino immigrants who came here in the 70s. That's my mom coming off the airplane with my little sister. She's holding pencils that she stole from the airport store. My mom is pregnant with my other sister. There's my Lola, who is very important to me, who is passing on my sister to my mom because my mom came here to find work before she brought my sister over, but my sister didn't recognize her when she came over. So I bring this up just because the immigrant experience is very close to my heart, and a lot of the work that I do is driven by the fact that I am coming from an immigrant family. And there I am, I'm the little baby. I'm also the youngest of 3 sisters, black sheep in the family, because I decided to go into social services and community work. My sisters are engineers and scientists making lots of money and have nice homes, and I'm digging myself more and more in debt so that I can serve the community. But that being said, they also very much support what I do, and I couldn't be doing this without them. So I was an activist in college. I was part of the Filipino Cultural Nights, if you've heard of something like that. So that's me acting in Filipino Cultural Night. And then when I graduated, I was like, how do I translate what I did as an undergrad to out in the real world? I ended up being a community organizer with community members in San Francisco, the Filipino community in the South of Market, the Soma, and helped them to get mental health services and reproductive health services and things like that. So there's just some pictures of the community members that I work with. I honor them because they are here with me today. Even if you don't see them, I bring all of that with me, and I bring their voices to the table whenever I go to the university, because I know that some of them can't be here for whatever reason, for lots of reasons. And so I remember that I'm supposed to, it's an opportunity and responsibility for me to bring them with me and their voices. So, as Erin said, I got a bachelor's in studies in biology, got my master's in public health at Berkeley, worked in community health, stuff like that, and then now I am at UCLA as a doctoral student, hopefully doing my dissertation this year and graduating next year. So yeah, so I showed you kind of an overview of what public health could be. How do you make this black? Can someone define public health for me? Take a guess. Awesome, perfect. So the science of protecting, this is the scientific definition, science of protecting and improving the health of communities through education, promotion of healthy lifestyles, and research for disease and injury prevention. So if you've heard, have you heard of the analogy of the river and public health? So like, you know, there's like this river and there's all these people like drowning. And so, you know, they pull the person out and then they see another person, they pull them out. They pull them out, they pull them out, pull them out, and they're like, what the heck is going on? How come there's so many people in this river? That's like what a doctor does. They see them usually when they already have a disease and they're just trying to treat them and save them. The public health person goes up the river and it's like, what the heck is going on? Oh, there's a broken bridge. I'm gonna go fix that so that people don't fall into the river. That's like a very, very crude version of that analogy, but it is like what's your name? Josie, like Josie said, it's preventing disease. And so through all these things. And so some of the things you could be doing are implementing educational programs, developing policies. So things like the Affordable Care Act is something that folks had to work on, administering services. So I worked at community clinics, which I'll talk about later. You could also regulate health systems. So making sure that, you know, folks who don't have insurance get insurance. And make sure that, you know, the systems that are in place are actually serving people in the correct language and things like that. And then conducting research, which is what I have transitioned to. I didn't always used to be a researcher. I used to be a practitioner, and now I do research. So this is kind of just an overview and other things I could be doing. And then like you've seen things like this, eat well to be well, or like things about condoms. Like, and so all of those things in the video that we just saw are public health. And so things like bicycles and even like education access, things that Erin and Mike are doing, that's all part of public health as well. And so, I just wanted to give an overview and some of the areas, and I'll give you a handout about this. I would be not doing my due diligence if I didn't tell you about these different areas of public health. And so when you major in public health or you go into public health, there's all kinds of ways that you can go into it. So statistics, biostatistics, like 1 in 4 people who smoke get cancer. Like, where did they get that from? Someone like a biostatistician had to do that. Environmental health, so places where there's a lot of pollution, a lot of kids have asthma. I'm from Oakland, and so a lot of the kids that live west of a certain freeway have a lot of asthma. Why is that so? Because of environmental health issues. Epidemiology is when the HIV outbreak happened in the 80s, they're like, how is this being transmitted? Or like, they call them like detectives, health detectives or epidemiologists. Infectious disease in developing countries like malaria and TB are very prevalent. So that's the thing that folks do. Nutrition, I think you know, like eating healthy, maternal and child health, which is what I focus on. I looked at reproductive health in the Philippines. There were policies that prevented women from being able to be healthy in that way. And so I was specifically looking at women's health there. Community health, which I'll talk about later, health and social behavior, international health, health services, and health policy management. So like if you run like Kaiser or the Department of Public Health, or you run, what are the big hospitals down here? Cedars-Sinai? No.
Not
I forgot. Anyways, but like St. Joseph, so like health policy management deals with like kind of services and then also policies like the Affordable Care Act. So I kind of ran through that really quickly, but I just wanted to, so that you know that there are these areas. And then there, if you go into a Master's of Public Health program or you go into public health, there's like these 5 core areas. And so I just wanted to list them there. And then there's these websites on the right. And I'll give this PowerPoint to Erin so that she can send it out if you want to learn more. So, all right. So this is the funner part. I get to just talk about where I came from. So this is like, we're in a living room and I'm just telling a story. So I thought I wanted to be a bioengineer. I saw this picture in a, this was back when we had like paper magazines delivered to our house. And I was like, this is amazing. There's like a baby coming out of a womb and they're like, anyways, I thought I wanted to be a bioengineer. I wanted to like create fake hearts and stuff like that. So I went to college as an engineer and I wasn't doing too good. And I wasn't enjoying it. And then I studied abroad in the Philippines after my first year. And it was one of the first times I was there as an adult. And I studied at the University of the Philippines, Diliman, which is like the equivalent of Berkeley, UC Berkeley over there. It's kind of like this activist university. And our professors there kind of exposed us to a lot of social injustices and brought us to community organizing events and things like that. And I was like, I want to do this. Like, this is awesome. Like, I want to work with community. But then I came back and I was like, well, how do I do that with bioengineering? I was like, I don't know. And it's not that you can't do it, but I couldn't figure it out. And so I was like, okay, maybe I won't do that community stuff. I'll work in a lab, you know. I worked in a lab as I cleaned like pipettes and I watched the graduate students like put things in like Petri dishes, and I hated it. I did it for 9 months and I realized this is not for me. But I would not have known that had I not tried it. And this thing about social justice was still like beating on my heart. We would organize around women's issues. All my friends, including Anna's older sister, was an ethnic studies major. And they're like, I was like, okay, I'll minor in ethnic studies because I'm interested in it and all my friends are in it. And then I was like, oh my gosh, I'm almost done with a major. I might as well just double major. And so I ended up double majoring in my last year as an ethnic studies major. But it was one of the best decisions of my life. My parents were like, what is this ethics studies, ethics something or other, ethnic something or other? And I'm like, they're like, you can do it, but you have to finish in 4. I was like, damn it, okay. So I finished 2 majors in 4 years, killing my ass my senior year and graduating with C's. And it was fine. I graduated and that's all that mattered. I didn't care if I just passed, but I think that background helped me do the work that I do now. It informs so much of the way that I look at the world, at the way I look at health systems, at the way I look at science. So after I graduated, I did this program called Community Health Corps. It's through AmeriCorps. How many of you have heard of the Peace Corps? So the Peace Corps, they like send you abroad and like, you work in a community. AmeriCorps is they put you in a nonprofit or setting somewhere in the United States and you work there for a year. And so I was in a program called Community Health Corps in San Francisco. And I worked at a free clinic for women who didn't have insurance in San Francisco. I got to, this is me pretending to be a doctor, but I was really a health educator. I met with clients that would come in, and most of them were uninsured, working part-time, some of them were homeless. I also did street outreach with women that were sex workers, and I worked with women that were homeless. And so, but that experience like made me fall in love. So as opposed to when I was working at the lab and I hated it, like when I did community health care, I knew I loved community clinics. And that's not to say like that the lab isn't for other people. Like I have friends that went on to be like super biochemists and like are changing the world as nurse practitioners and things like that. It just wasn't for me, but I wouldn't have figured that out unless I had done it. And so I encourage you all to try things and see if you like it. And if you don't, then you know you don't like it. Then you know that it's not for you. And so from that first year at a community clinic, I ended up becoming what's called a public health planner. So what I do is that I work with communities to help them plan community health services that serve their community. And so I'll give you some examples. So I worked at this place called La Clínica de la Raza. Anyone here that speaks Spanish? What does that mean? La Clínica for the people. The clinic for the people. So it's this amazing community clinic in Oakland that was started in the 70s that serves 90, probably 100,000 people now at 30 different clinics. And most of the services are in Spanish. And I speak high school level Spanish. I tried my best, but I worked in the planning department. So what my job was I was getting funding so that I could help them do their services. So they would do like street outreach. One of the awesome programs I used to manage was they were doing domestic violence prevention using street theater. They're called promotoras. Promotoras are health educators that are from the community, and they go out and would do like theater performances about issues. In this case, it was about just domestic violence. And so that was $500,000 from the federal government. And so I managed about $3 million in grants. And I was like 24, something like that. Or no, not 24, 26, 25, 26 when I was doing that. But there's like tons of these community clinics all over the nation. And the reason that we need these clinics is because we don't have universal health care in this country. And so if you don't have insurance, you have to either go to a community clinic or you just don't go seek care, which sucks. Because then people go to the emergency room and they're really, really sick. And so one of the things that we do, we're called safety net clinics, community clinics like La Clínica de la Raza, and then also Asian Health Services, which is also another place I worked. We provide services to people who can't afford or don't have insurance. So yeah, as you can see at Asian Health Services, they are fluent in 11 Asian languages. So also, even if you have private insurance, sometimes you go to your the place that you have insurance and like they don't speak your language, whether that's like literally your language, like Tagalog or Cantonese, Vietnamese, or they don't like relate to you, like they feel so disconnected. And so one of our missions is to serve and advocate for the medically underserved, including immigrant and refugee communities, and ensure access to healthcare services regardless of income, insurance status, language, or so just examples of places that provide community health services. And then another place that I was working with in San Francisco was the Filipino Mental Health Initiative. So that's the focus of what I do now. I grew up, I'm trying to determine, oh, I'm on live stream. Okay, I can't be that personal. But this is a very close story to my heart. And so this issue, because of family and things like that. And so I am so blessed after working at these two clinics that I got to work with the Filipino community, which is the community that I came from. So that being said, on your trajectory, you might not get the most amazing, perfect job that you want right out of college or whatever, or even grad school, that'd be good. But you just keep doing things and see what you like, and then eventually you'll get to what you want. So if you keep working at it. And so, so one of the things that I do with them is that we were doing something called digital storytelling. So in my other life, where's my bag? I think it's on the bio. This is my bag. It has, does anyone know what these are? They're like musicals. So I'm a musician in my other life. And so I was trying to figure out, how do I meld public health and music and theater? And one of the ways that I've been able to do that is I make documentary films. I am helping to put on theater productions. I play for musicals and stuff like that. But it's very central to what I am. And I used to say that they were in my other life or separate, but I found a way to put them together. So that being said, I'm going to share with you. Let's see. So during my master's program, I went to the Philippines. And I think I mentioned I was doing stuff around reproductive health. And so one of the things that I had heard from community members was that there's a statistic around, I think it's 4 women in the Philippines die every day because of abortion, because there aren't safe services and it's illegal. And so people just go underground. And so I was like, how do they do that? Like, you know, where do they get their drugs or where are their doctors? But I heard a story from women over and over that they would go to this marketplace in the Philippines in Quiapo, which is a big church, incidentally. And there's like a big market, like right in front of the church where you buy like chickens and clothing and vegetables and fish and all kinds of stuff. And so I was like, okay, I'm gonna go check it out. Like, what is this place and how do you get the drugs? Because it's illegal. And so this is my story, digital story about that. So if you could hit the likes for me. Try not to fall asleep.
Since I returned from my internship in the Philippines, the land of my ancestors, I've been cautious to share about it. It's been 3 months now, and this is the first time I'll be sharing this story. I walked into the market, my second attempt in 2 weeks, delayed because of a police raid the week before. It's as if she already knew I was coming. A young girl looking lost, stomach bulging. I wore these pants on purpose. I've gained 4 kilos since I got here, and I blame the 5 meals a day my coworkers stuffed me with. She wears a towel on her head. Her wooden stand sells bottles, glowing rocks, roots, and candles, portable stands, cloths to cover the goods, just in case the police come. She waves me down. I ask for pamparegla, an herbal concoction that supposedly induces abortion. She nods her head ever so slightly. Ilang buwan ka na? How many months are you? 2 po, 2. Sigurado ka? Are you sure? Opo, yes ma'am. Pamparegla won't do anything for you. She suggests I buy tabletas for 1.5. Wala akong 1.5. I don't have 1.5. Anong budget mo? What's your budget then? 1,000 lang. Just 1,000. 6 instead of 8 is her deal for my meager 1,000 regimen. She explains to me how to take it. I hand her 1,000 and she tells me to lakad, walk. She puts her hand in mine, slips me a little blue plastic bag, and we slip ways. How easy, quick, furtive. Police officers arrive. The vendors have disappeared. I stand watching, waiting. An hour later, they return. Back to business.
This was 8 years ago.
There are times when I wish I never left the Philippines, but I know there are reasons why I'm back here in the States. Sharing this story is one of them.
So I made that like, oh, you can hit play. So I made that not eight years ago. And it was a workshop that I attended as a student, as a graduate student at Berkeley at the Center for Digital Storytelling, which is now called Story Center. You want to look them up. They have a bunch of videos on their YouTube site, which are actually about mental health, reproductive health, foster youth, violence, shooting, all kinds of issues. But the idea is that they help folks tell their stories in a creative way. And obviously, it's not like a blockbuster documentary. It's like 3 to 4 minute films. And so since then, I worked with them for like 5 years. And I was helping foster youth and women who are in domestic violence situations like tell their stories. And so even folks who have never touched a computer, like I've worked, and we do it in a 2.5-day workshop. And surprisingly, like even folks who are like 80 years old or someone who's on the street, like we get them to finish it in 2.5 days. And it's just kind of like a better way to kind of educate about issues rather than just doing like a typical health education program is like, okay, this group of 20 people is gonna come to a workshop every week for 10 weeks, and we're gonna tell you about healthy eating, or we're gonna tell you about this or something. And people just drop out, like who's gonna go to 10 weeks of something? And so I think one thing that I've found in health education is I use social media, we use videos, documentary theater, art, and I think that is more effective in the spaces that I'm at. And so one of the programs that I was doing around domestic violence in the Latino community in Oakland was that we would do drumming circles with the men, and they would do it with their sons. Or we would do something like bring in indigenous healers. And some of these things, if you know about health services, are not quote unquote reimbursable. And so, because they're not evidence-based, supposedly. But these are the things that I see working in immigrant communities. And so one of the reasons I went back to school was because I was frustrated with the system. I was like, I know that this works with my community. How come you're not renewing my grant? Or how come you're not letting us expand this program? And they're like, well, you're not collecting the data about its impact. And I was like, okay, I'm going back to school. I'm going to learn how to collect that data. And so I've been, the past 4 years, I've been in school and trying to figure out how do you measure the impact of theater on people's behaviors, on their attitudes? How do you measure the impact of art and music and open mics and drumming circles and things like that, which are not typical, but I think are things that I've seen work in the community. So where do I want to go from here? I'm going to stop there for a second and ask if you have any questions, and then I have 5 more minutes, and I was going to choose. Oh, from that video that I just shared. So these are like, pampa regla is something that I've heard in the Philippines. It's like a concoction. It's an herbal concoction that women use to induce abortions. And then these are some of the other things that I had heard of, like roots and like illegal drugs and stuff like that. But that was my way of doing quote unquote research at the time, but that I didn't know was research. But it was to help the nonprofit that I was working for in the Philippines advocate to Congress that, hey, we need to pass a policy that helps women, poor women, get access to contraception so that they don't have to keep inducing abortion. So, and how I got into this, I think Erin wanted me to talk about how I got into it. So when I was in undergrad, I just used to like making videos. And so I used to like make slideshows for my friends' birthdays and pictures from Facebook. And then I realized, oh, okay, maybe I can make a video about my study abroad experience. So I made a video about that. I didn't consider myself like a filmmaker. And then, I started having these classes where we had to make videos. I was like, oh, okay, I can do that. And then I ended up becoming the digital story intern. I was just doing it for fun at first. And then now I won't have time to show it. I think I have until 11.
11:05.
Okay. 3 years ago, I think, was Erin in that class? Oh, she took it after me. We took a class in Asian American Studies called Ethno-Communications. And it's a documentary filmmaking class to tell the stories of our communities. And if I have time, I'll show a little bit of that. But this is kind of like my journey. Like I was just messing around on my computer, like for birthday stuff. And then I realized, oh, I could actually use this for advocacy and for the work that I'm doing. So that's the place that I used to work. And then this is another project that I worked on. It's called the API Wellness Center's, API is Asian Pacific Islander Wellness Center's Banyan Tree Project. And so it was their project around reducing stigma around HIV in the API community. So if you Google that, API Wellness Center Banyan Tree Project, you can find their YouTube channel and you can watch some of those videos as well. So I helped to facilitate some of those workshops, and it was really enlightening. And so, like I showed earlier, I've been organizing with different communities to then help them develop services that are culturally appropriate. So this is the Lao community, the Cambodian community, and the Samoan community in San Francisco. So even if I'm not from those communities, I think also one of the reasons I went back to school is because I went back to school, or I was working in the field, working with immigrant clinics and immigrant community organizations. And so many times when we were asking for money from the funders, we would be sitting at a table. This is the community organization, and that's the funder table, asking them for money. All puti. They don't know who puti is. It's Tagalog. They're all white. And not that white people aren't down. There's totally white people that are down. But like they had never worked in community and had no idea what was happening on the ground with my community. So even if the Cambodian community, the Lao community, and Samoan community aren't my heritage, like they would see me as someone that was advocating for them. And even though I didn't speak their language, I spoke for them, or I could help amplify their voices in a way that maybe someone else can. And so I encourage you to think about where you came from. One of the quotes that's on my, I'm gonna butcher this, but it's a quote in Tagalog, and I'll just say it in English. But there's a quote that goes, if you don't know where you came from, how do you know where you're going? And I switched it in my email. I changed it, and I said, she who knows where she came from knows where she's going. And so I encourage you to think about the communities that you come from. I showed the picture of my Lola, my grandmother, and my mom immigrating. Think about where you come from, who came before you, your ancestors, and how does that inform where you're going to go in the future? For better or for worse. But I just encourage you to think about that. So more pictures. This is with the Filipino and the Southeast Asian community. So yeah, why do I do this? Why do I think this is important? Creative methods of health education using theater and things like digital storytelling is because there's a lot of shit that's gone down in the world. Oops, sorry. Hi. Our communities passed. So I come from a country that was colonized for 400 years. There's a lot of racism in this country. There's a whole bunch of crappy things that have gone down in the world. And in order to heal and to grow, we need to address that. And so one thing they call it is historical trauma. Our communities, even if you haven't, so most people think about trauma as like something that happens to them individually, but these things happen to our communities. And so to heal, I believe that health education has to be done in the community. And that can be done with art and theater and these kind of non-traditional methods that are not one-on-one therapy. Silence, there's a whole bunch of silence in our community and shame around things like reproductive health, abortion, mental health, HIV. And how do you break that silence? And sometimes art is the only way to do that, or is one of the best ways to do that. Empowerment through participatory action, that's a really long word. When we ask, instead of me telling someone else's story, I'm inviting them to tell their own story. And so all of these workshops that we would do, it's people telling their own, we help them, but they're telling their own story in their own way. And so there's it helps us see ourselves in other people. So even if a story isn't directly related to you or you don't resonate with it, hopefully through art and theater, you get to see someone else's point of view. And it connects generations and changes the narrative. A lot of the work that I do right now is trying to like connect immigrant parents with their children and like that conflict. And like, how do you do that? It's tricky. And I think art is a medium to do that. So I'm back in school. This is me with the historic Filipino town mural. Has anyone been there? Historic Filipino. It's in LA. It's kind of far from here. But so I'm back at UCLA, and I look at theater and film for mental health stigma reduction in the Philippines. And why is this important? I'll just bring this up. So when I was in undergrad, I was part of a group with Anna's sister, Fatima, and we like did these weekly brown bag lunches with Pinays, which are Filipino women. We were interested in Filipino women's issues and wanted to create a safe space. And one of the things we learned was that suicide attempts are highest among Filipina young women compared to other ethnic groups. There was a study that was done in San Diego. It's crazy. Like, think about, like, maybe they're not completed attempts, but they attempt. And so, like, what the heck is going on? Like, what is it? And so I also did some more reading and found out that depression is really high in the Filipino American community compared to the general population, but then also that there's low help-seeking behavior. So folks don't go out and seek services because of stigma, that there's no Tagalog-speaking provider, that it's just not culturally appropriate. And so that's what kind of brings me to the project I'm doing now, which is called the Kamalayan Project, which means awareness. And it aims to uncover stories of mental health challenges and stigma in the Filipino community. And I won't go down here, but I just wanted to kind of let you know, like, this is what I'm working on now. And there's a lot more text here that I don't know. So yeah, so that's kind of what I'm up to now. And to end, I kind of just wanted to end with this kind of lessons learned over the years. I stand up in front of you and it seems like I have my shit together and that I knew every step to take along the way, but I didn't know what the heck I was doing. Like, I was just taking a step forward and trying something. And I failed at a lot of things, and I still fail at a lot of things. And so I think one of the lessons that I've learned in the past couple of years, even at UCLA, is just resilience. And like, just keep on putting one step in front of another. This is a post by Leah Salonga when was this? Like last year. And she's like, talking about like that, you know, people are gonna think about you in a certain way and you just have to break whatever perceptions that they have of you. And so people told me like, well, you can't do that project. You can't do that. And I was like, oh no, okay, I'm gonna drop out. Like a couple years ago, I was like, Erin, I think I'm gonna drop out. I don't think this university thing is for me. And then I go back to community and they recharge my battery and remind me like why I'm doing this. I'm doing it for my family, I'm doing it for my mom, I'm doing it for my community. But things are gonna get in the way. Just keep going, keep going. Mentorship, so important. Keep in contact with these two, they're rock stars. Erin and Mike, or what do you call them? Professor Erin and Professor Mike. But whoever it is in your life that keeps you going, hold on to them. And the other thing that I learned at Berkeley when I was doing community outreach is lift as you climb. So as you are, you know, you're at a university. How many of you are the first in your family to go to college? How many of you have little brothers and sisters or cousins or know younger people? So as you climb and go on to your amazing careers, remember to mentor others as well. As I said, I couldn't be here without them. And oh, you know Janice. And this is one of my professors. And now I mentor his daughter. And then stay rooted is the last one. Prioritize self-care, whatever your community is, whether it's your family or you have another community, like stay connected because to get to where you want to go, you gotta have roots to weather the storm. So this is a picture of me and my friends during senior year with our community Filipino organization, and we were remembering how we're all connected and rooted. And then I also teach Tagalog. I'm not a language major at all, but being connected with the Filipino students at UCLA keeps me rooted. Like it keeps me going. I don't teach right now, but I have in the past 2 years. Those are my students. And then I also stay rooted and engage in self-care by just playing the piano. So now I make money, which is nice. But I have a wedding gig on Saturday and a couple of church gigs. And I make a little money, but it keeps me sane. Because like, if I wasn't doing something other than school, I would go crazy, like literally. So make sure you find whatever, whether it's running or art or whatever, going out dancing and clubbing. And then I keep reminders on my desk. So that brings me to my last thing. So on the back, sorry, I ended up not calling your names, but on the back of your card, I want you to flip it over. I have like 1 minute. So I want you, I know that you're exploring different careers through this class. Maybe you don't know where you want to be in 5 years, but this is an activity that someone had me do. And I do this continually, like every couple months to remind myself. So I want you to write down on your piece of paper, I am so happy and grateful. And this is an activity from a friend of mine. Happy and grateful. To ... And Mike, you can do this too if you want to try. I don't know where they are. Okay. You're good. And so think about yourself who we're going to be in 5 years. And maybe you don't know what that is. But what is your life going to look like? And instead of saying, in 5 years, I will, you're just going to speak in the present. You're going to pretend that you're 5 years from now, and you'll be like, I'm so happy and grateful to whatever it is. Maybe you already know what you want to do, maybe you don't. Maybe it's just like, I'm so happy and grateful to be in a job that I love, to be around people that I care about, to live in a place that I like, or something like that. Something, to have a pet dog that I have always dreamed of having. But the idea is, so I'll give you 1.5 minutes to do that. So just jot down something. And if you don't know, picture. Maybe you're just so happy and grateful to be alive. Yeah. And then, so I'll give you a minute to do that. And you don't have to share this with anybody. It's just for you. All right. And it's things like these activities or reflections that keep me grounded. I keep things on my desk that remind me. This is a card from community members that they wrote me when I left to go to my graduate program, wishing me luck. So when I feel like I can't do this anymore, I want to drop out already, I want to move home, I remember that they're rooting for me. So whatever it is that keeps you grounded, I encourage you to hold on to that. So, yeah, and the last thing, was that the last thing I wanted to do? Oh, and then we're going, so there's something that I want to show, but I can't do it on the live stream. So we're going to end the live stream, and then we'll do it. But yeah,